if you're watching this clip, I gather you hit the button below and you took the next best step in ensuring optimal health during this time of COVID-19. And for that, good on you. As I said in the previous clip, I believe that the strength and the success rate of 93.7% in China is due to the combination of uses of Western medicine and Eastern medicine, and in particularly traditional Chinese medicine. Western medicine is particularly good in dealing with the critical aspect of a disease, the ventilators, the medication, antibiotics. What they lack is the fine points leading up to that and how to head that off at the pass, and also the critical needs that a patient has once they are recovering. In that sense, what they did in Wuhan Province was really, really good, and it contributed, as the way I see it, to their success rates. Now, when COVID-19 first broke, we didn't have enough information about some of the unique pharmacopoeia that was being used for this. So my go-to formula, and it was a good instinctive thing to do, was to use a traditional Chinese medical formula called jade screen, which is based around 3 herbs: atractalodes, sciller, and astragalus root. Now, for stage 1, what they did in China is they used that particular formula to deal with the asymptomatic phase. So stage 1 is when a person's asymptomatic. He may or may not have COVID-19, and he's not showing any signs of it. So this is a stage in which you want to boost a person's immunity to prevent them from possibly going south, or from it getting to stage 2. So jade screen, here's the augmented jade screen, which is the formula that at Wuhan Provincial Hospital, they added 6 other herbs to the formula in order to reduce the viral load. Two of these herbs are actually found in stage 1 and stage 2 of these protocols and both formulas, and they are both herbs are respectively gala root, or gala, and Chinese mahogany leaves. Chinese mahogany leaves, I believe that in the next couple of years will become very in vogue, because what it does is it actually deactivates the P strands. Those are the strands that are around the coronavirus that allow, it's like those spikes, those fuzzy spikes around it. It allows the virus to enter into a cell and replicate. And what the compounds found in mahogany leaf do is they deactivate the virus. So we're not bombarding the body with anything that could possibly irritate or attack healthy cells. We're doing something very passive in a way. It just allows the virus to run its course and not make the person ill. This was actually studied in Taiwan. There was a study done after the SARS-CoV, which is, and again, SARS and coronavirus are very, very similar. In fact, they're almost identical in the way they look. So the study that was done in Taiwan demonstrated this, and it demonstrated that it actually worked in 2 arenas. One is the nasal passages, and the second is the throat, when the virus, and that's where the virus accumulates before that's the first area that it attacks before it actually penetrates deeper into the body, into the lungs, and into the digestive tract. So for stage 1 of the disease, stage 1 of the disease, they recommended the augmented jade screen. Now, at the first sign of any of the common symptoms, such as headache, sore throat, nasal drainage, or a fever, they went with, again, this is it's based on a classic formula called honeysuckle and forsythia. In Chinese, it's commonly known as yin chow. Here's the bottle. This is the augmented formula, which again has the 2 herbs that are present in the stage 1, which are, again, gala and Chinese mahogany leaf. So at the first sign, let's say you were on this and yet the condition went south with you, you would go ahead and start using the stage 2. Now the formula for stage 3 had 2 herbs in it, or has 2 herbs in it. One is ephedra and the other one is asarum. Asarum is also known as wild ginger. Unfortunately, both of these herbs have ingredients that have been banned for over-the-counter sale, and as much as I wanted to bring this in for people, I couldn't do it. Not only that, stage 3 is a very critical point in the disease in which you need to be hospitalized. It's very dangerous, and this is actually stage 3 is where Western medicine is really very good. So again, you can get formulas and you can be treated by a traditional Chinese acupuncturist or somebody who has a degree in TCM, and they have access to these herbs and they can administer them, but it's nothing that I could bring in myself. Now the 4th formula, or the 4th stage, which is recovery, the go-to formula is a formula called Autumn Rain. It's available in pill form. That's the stage where after coronavirus, people are very tired. They may still have respiratory problems, maybe even a little bit, they may have a lingering cough. Their sleep's not good. Their general energy is very low. And Autumn Rain is very good for that, and you can pick that up almost anywhere. But I'll have more information on at the bottom of the screen. I'll put the link to all the articles that I wrote on COVID-19, especially the antiviral Pharmacopia and COVID-19. Another thing to remember is, let's say you start using this now and this whole thing blows over in another month or so. We're living in a unique reality in which, just like we have a flu season, we may have a COVID-19 season, and it may come again, and we will by then have some type of herd immunity. But even with herd immunity, we lose 32,000 people a year to the influenza virus. So maybe this is just something good to have on hand in the future. And the good news is that even though there is a 2-year expiration date to these formulas, you can still freeze them, and then they'll last indefinitely, and they'll be there whenever you possibly need them in your quote-unquote medicine cabinet. So let's give this a taste test. All you need is just 1 gram of the 5-to-1 concentrate. This is my plastic 1 gram spoon. That's about all the powder you need. There's that bottom of my mug. Now, there's an important principle in herbology that says that your formula is only as good as your ability to absorb it. One of the herbs that I love to use in order to encourage a formula's digestibility and absorbability is this guy over here, ginger. I like the flavor of it, but it's commonly known in herbology that ginger increases a formula's ability to be absorbed and digested. So what I've done here is I've sliced up some ginger, boiled it in some hot water, put it in my little mini press, and that is what I'm going to use as a base for my augmented jade screen formula. Now, Chinese herbs are not famous for being yummy, I can tell you that much. Although I did find a source for these that did a better denaturing of the herbs, so they're not as bitter as they would have been had you purchased them from a acupuncturist and he sent you home to boil them. You would have ended up with something pretty bitter. This is not as bad. That's it. So let's give it a little taste. There's a little bit that didn't dissolve on the bottom of my glass here. Should probably get a spoon, but just for our purposes here, let's try it. As I said, somewhat denatured. The ginger it actually takes over most of the flavor here, so it's not so bad. So anyway, if you or a family member is in the high-risk group, I welcome you to go to the website and purchase these. I don't have very much left. Actually, I didn't have very much to begin with, but if there's a little bit that I can do to help anybody out there, by all means, go to the website, order them. As I said, Jade's Green for just to stay healthy. And if you feel that you're coming down with anything, honeysuckle and forsythia. And with that, I wish you the best, the healthiest, and that we all come out of this on the other side. Be healthy, be happy.